My name is Amir Fathi. I'm a clinician treating leukemias and myeloid neoplasms. I work at Massachusetts General Hospital Cancer Center in Boston, and I also direct the clinical research effort there. I think there was some exciting data that was presented. Gilteritinib is a very potent and very selective FLT3 inhibitor. There are two types of FLT3 mutations, predominant types of FLT3 mutations. One is called the ITD mutation, which is the more common variant, and the other less common variant is called the TKD, or tyrosine kinase domain point mutations. The neat thing about gilteritinib is that it hits both types of alterations. Many patients who may have the ITD mutation and are treated with another FLT3 inhibitor ultimately develop a resistant TKD mutation later, to which they may not respond anymore to their initial FLT3 inhibitor. This drug hits both types of FLT3 variants, which is very exciting. The data that was presented from the Chrysalis trial showed that there was in patients who had relapsed refractory FLT3 mutant disease who had previously been, many of them who had previously been on other FLT3 inhibitors, also continued to respond to this FLT3 inhibitor, gilteritinib, with a very impressive composite remission rate. So I thought that that was very exciting and interesting. We just also learned about some updated data from the combination of traditional chemotherapy, induction chemotherapy 7+3, plus another FLT3 inhibitor called crenolanib, which also hits both variants of FLT3 mutations. I think that we have been testing for FLT3 mutations for some time. The challenge is to get these results back in a timely manner so that patients can start on treatment. So if they have a FLT3 ITD or a TKD mutation, they can start on treatment when some of these therapies become more standard, or if they want to participate in a clinical trial that targets these specific mutations. So the timeliness of results and the rapid turnaround is one important feature. The other is that there are certain aspects of FLT3 mutations that are also independently prognostically important. The length of the ITD mutation has some prognostic significance. The allelic ratio, meaning the more FLT3 burden you have, also portends a worse prognosis. That's also important. So those are things that I hope will become available when patients are tested for FLT3 mutations.